Hello and welcome to A Lot of Help with James Lott Jr. I am James Lott Jr., certified life coach, among other things. And this is my show, A Lot of Help. It's been out, God, for almost 4 or 5 years now. So I like bringing guests back. We've had them on for a while back and bring them back and see what they're up to, see what they're doing. It's all kinds of, sometimes they're doing different things, they do the same things. We like to check in with them and see what's going on because the world has changed. As I was just talking to this guest in the last 3 years. So you think I do a lot? You think I have a lot of names? You think I got a lot of titles? This person also, besides being a flight surgeon in the U.S. Air Forces, for in the Air Force for years, he's a physician. He's an entrepreneur. He is being recognized in the last few years in all these big time magazines, things like Forbes. You've heard that magazine before. He's an executive coach. He's a speaker. He's an author. And he does a lot of stuff. So we're going to get you. So those of you who don't know who he is, you're going to know who he is today. And he's also my friend, Dr. Clarence Lee Jr. How you doing?
I'm doing well. I'm doing well, James. Thanks for having me back on. It's
Yes,
good to see you.
we're the juniors. That's right, James Lott Jr.,
Yeah, man.
Clarence Lee Jr. That's right. Um, I'll ask you this question. I ask this to all my juniors out there in the thirds and the fourths and fifths and stuff. What does it mean for you to be a junior at this stage in your life? What does that mean to you?
You know, it's kind of, I don't say it's a deep answer, but um, my dad wasn't really in my life when I was younger a lot, and so I struggled a bunch with this idea of how could someone have a son and not really be involved, and I really hung on to the fact and idea that he gave me his name as his like validation of me, like even though he may not necessarily have been there, but he gave me his name and I was special to him and all that. So like to me, that's what the junior kind of symbolized for me. And I mean, my dad's in my life. He actually lives out here in California with me now. But I just remember growing up, that's what the significance for me. And so now I actually gave my son, my first son, is the third now. So it's one of the things where I talk to him, and it's something that me and him share, that we have the same name, and there's a special connection there. So it may be just a name, but it carries a lot for a boy and a son and a father. Yeah. So
Mhm. I think when you name someone, whatever it is, it does walk with them through your life. It can, especially if you're named after someone, whether it's a grandparent, parent, aunt, uncle. There's an added thing in there. I know some people. I've asked this to many juniors and thirds, and their answers are similar to yours. It's kind of like it's a connection. I'm a junior. My father wasn't in my life that much either growing up, so same difference. But my father was famous in certain circles, so I always ran across, "Oh, you're James Lott Jr." But now they're saying to him, "Oh, you're the father of James Lott Jr." So now
come
it's
on now.
around. There you have it. And I don't have any sons. I have daughters, so I didn't get a chance to name. But maybe some grandchild will have my name, I guess, or something about it. But so far, I don't have that.
That'd be cool.
But it's very, but you're right. It's very interesting because you're like it's. I still feel like myself. I'm fully like you're fully who you are yourself. But there is a little connection of that of being a junior, like you're sharing a name.
Yeah.
Now you have an MD and an MBA. I'm like you are. I always say physicians are business anyway, and that it's all business kind of anyway. But you literally are a business, and you're also practicing. So I mean, so kind of tell folks what that means, and let's begin the conversation of what that means.
Yeah. So a physician entrepreneur is someone that I mean, an entrepreneur can be everything, but being able to start businesses, but in healthcare specifically, and with physicians having ownership of the entities that they practice under. So the far majority of physicians are going to be employed, meaning they are either W-2, they're an employee of an organization, and they work and practice medicine underneath the umbrella of an organization that they do not have equity in, meaning there's no ownership relationship between the provider and the entity that they work for. And so, as a physician entrepreneur, as a business person, it is my belief in my practice, and kind of the pandemic kind of led me there because I used to be an employee. But it's my belief that one of the key things to changing healthcare and bringing increased job satisfaction to physicians, better patient care, better quality of life for healthcare workers is actually returning the physician to ownership of medicine. And this is actually how it started. Then we kind of got away from it. So I think if physicians have ownership and are leaders in organizations, and here's a fact that most people don't know or don't think much about, there's very, very few hospital systems that CEOs are physicians. Very, very few. And so, my question is, why is that?
And how can you effectively run? Well, you could run. I mean, if you have business experience, I guess, but I would think the medical background touch would help you run a hospital better.
I would too.
I would. I know you're being very dramatic. I love it. I'm just like I'm just saying it out loud. Just that's the statement I'm thinking that way. I used to be a nurse, so I do. I worked in medical systems, and I'm just thinking, yeah, it would be interesting if they had both backgrounds. They could actually really run a hospital effectively.
Absolutely. And I think the perspective there as a provider really kind of changes how you approach things. So it's really easy for a business to come in, and I don't want to get too deep into the tangent because I'm really passionate about this right now. But if you have the perspective of a provider, you're going to view things a little different opposed to if you're a business person and you're bringing in some Jedi Six Sigma efficiency like approach, then it's going to be really easy for you to say to a provider, a nurse practitioner, a PA, hey, I need you to see this many patients in an hour. I need you to see a patient every 10 minutes. I need you to see a patient every 12 minutes. Well, have you ever seen a patient every 10 minutes? Like, do you know? So I think that most physicians, and I just want to throw this in here because we had a recent loss of a physician resident via suicide actually last week, and suicide is one of the physicians in training. The most likely cause of death in physicians in training. One of the top causes of death for physicians in training is suicide, and you have to ask yourself why. And I think part of the reason is because you have these models in place that are driving the providers for efficiency and kind of looking at the only metric as productivity, how much you produce, how much revenue you produce, and kind of downplaying kind of the workplace environment and the health and well-being of the providers. So physician ownership, man, it goes deep in this thing. And I really feel like if you return the physician back to leadership where they have operational control as well, you'll see the delivery of healthcare change.
Well, I mean, okay, so I always wonder, we don't ever really think about the general public, think about the health and well-being of our physicians. Isn't that funny? We just don't really think about it. We just assume they're all be fine, they're good to go do their jobs. But I think we got some semblance of that during the COVID stuff, the heavy COVID days. We got a sense of people, how rough it was. But I don't feel like we ever think about that really so much, the general public. Just like, well, you have a doctor, a nurse, just right there, whatever. They're fine. They get paid lots of money, and they should be okay. And that's it. I mean, that's the perception, isn't it? But that's really not. We got to think about you guys' well-being and health, and are you being taken care of, and how that affects your patient flow and everything.
Absolutely. If the provider isn't, and they've kind of done some work in our kind of restrictions and things in training and physicians that are in training. But I know when I was coming up, so we're talking, I've started medical school in 2006. So we're talking 15 something years ago. It was expected that the medical students and the residents would show up hours before everyone else to do rounds multiple times. And it was expected that you would stay later than everyone else because you're there to get experience. You're there to get the training. There's really no incentive for you to leave the hospital because as soon as you leave, your colleagues, your other trainees are going to get that experience that comes in overnight. Oh, you want to go to sleep? Okay, well, fine. We'll stay here. And that great case will come right in and you're going to miss out on everything. And so, in our line of work, experience and having seen things is significant because, like, once you've seen it and you have that experience, you're a different clinician after that. And we're really judged, and the expectation is that we have seen things. And in order to see things, it takes time. And so there wasn't, I know when I was training, there wasn't really much incentive to stop work, go home, get rest. It was, hey, you're gonna go to sleep. Okay, great. Well, I'll take that case. And it's like, hey, you're hungry. Oh, well, somebody just came in. They got stabbed. You
Right.
want to go and eat right now? Oh, okay. Like it's kind of like
Right.
unheard of for the provider to put themselves first, especially when we're in a giving and caring, altruistic type of field. It's really expected that we're put others before ourselves.
Yeah. Also patient care. Um, and I'll say LA because I can't really speak for anywhere else anymore. I used to live in San Francisco, Pittsburgh, other places, but I'm gonna say in LA. Um, in the big hospitals and things, it has gone down. The care has gone down in some ways. It's less than satisfactory or just satisfactory. And a lot of patients are like they need specific care and attention and time. And so I would think have if you're a provider and you have your own business, you could run it, the way you like to run things, where it is less patients per hour you're seeing, less, or less patients period per day you're seeing. That would benefit the patient so much more than like, okay, well, I got you right now, but my foot's halfway out the door as I'm watching you because I got a patient down the hall. Like, I'm sure this makes things a lot better.
Absolutely, and you're willing, at least me as a business person and a doctor, you are willing to take less profit, pay your employees more for a greater experience. And so for me, when this idea of Exhort Health came, it was really, I wanted to create a place that, one, I wanted to work for, and two, that patients wanted to come. And and so I think if you take care of your people first, meaning the providers, the MAs, anyone that touches that patient, if you take care of them, you pay them what they're worth, you treat them well, they're going to be happy. And if they're happy, then the patient care then is coming from a place of abundance. It's not coming from a place of lack or drain or burnout. It's coming from a place of overflowing and bubbling, right? And that is going to impact how much energy goes in the patient, how much time you give the patient, how much attention you give the patient, and the overall quality of care for that patient. And so, if we, again, I'm going to keep harping on this.
I
If
love
private equity exits, you can now have a business that decides intentionally, I'm going to take less profit. I know I'm going to take less profit by seeing less patients. However, my quality of care is the metric that I'm going to go after, right? As a business, as a healthcare organization, the quality of my care is what I hold the highest. But obviously, you have to make money. You have to generate revenue. Obviously, you have to stay. Your doors have to stay open. But my challenge when we're talking about this for healthcare organizations, here's my challenge: become more savvy in ingenious or creative in the ways that you bring revenue in. Instead of only thinking of the way to bring revenue is to see more patient be more efficient, right? Which is going to drive down the quality of care because you're going to spend less and less time with the patient. Instead of just being kind of basic like that, how about we bring some other ideas in ways that we can generate revenue and bring value to the patient? How about we become a little more innovative in the ways that we generate revenue or add value to the patient?
My doctor is an entrepreneur physician. So Dr. McHale, shout out to him. He started out at UCLA, and he opened up some practices here in Westchester and by LAX, where I live in Inglewood, over here. And I've gone in for years. And he's like, the care is so much better. Everyone's smiling. I mean, the person at front desk is smiling. Like people are watching this. They know this. You go somewhere, you can tell when people hate their job.
Yeah.
You really can feel it. And we don't need that when you have a medical issue. I mean, like you're coming because I'll give an example, and many people know this already. In 2018, I had a severe case of Bell's palsy. But when it was happening, I was freaking out because I couldn't use my mouth, and my face started to droop. So if I had walked in somewhere and they're just like, oh, yeah, whatever, or had attitude, I'm already scared. Know what the fuck's going on? And I'm trying to get to, but they were so kind. They basically, sat me down. They sure I was okay. They kept me calm. Well, we figured it out. I just thought just from the moment you walk in the doors, it was just like every time you go there, it's consistently, and I love my doctor. It's consistently like it's nice. And so that's when I first heard of kind of this. Now I'm going to my own practice, so to speak. I'm becoming my sole proprietorship, all that kind of thing, or LLC. Or I mean, I never really heard that so much in terms of that. So I was like, oh, this is very interesting. He's like, no, I work with the other people and I work with companies, all this kind of stuff, but this is my practice. I brought my doctors in, I brought my nurses in, and I'm like, okay, we have our links with our certain labs we go to. They said, and the labs that I go to, they're nice there also. So it's like they're no, I mean, it is a difference than when I had other organizations for my health that didn't care for them so much. But this one I felt like not just a number or not just my social security number. I didn't feel like just like my social security number.
Yeah, no, that's an excellent example. It's an excellent example right there. And I'll throw this a little bit in there. When the physician has equity versus when they don't, the intention that goes into that patient visit, because this isn't just a job for a physician entrepreneur. This is your business. This is everything. It's not just a job or position that you have. Whereas if you have a provider in a position of employment, they may not take the personal responsibility for the integrity um, or the reputation of the company, right? They may not take that on as a person,
Right.
but as a physician entrepreneur, those Google reviews, each patient visit is a lot more significant when you have equity. And so I think that also, kind of plays into the different forces that are influencing the provider in that room.
Yeah. And again, as patients, we don't think about any of that stuff. We don't think about it. It's like we just want to come in and you're taken care of. I
Right.
slice my hand.
Exactly.
That's all you care about. You really,
Right.
and when you get bad service, you can't reach anybody on the phone. When you can't, it's all because of this stuff. And I totally agree with you. And it's just, I think we got, and health is your most important thing. But how do you? So I'm an entrepreneur also. I have several businesses. I'm an entrepreneur. I've been doing it for 13 years. But I know I've heard people tell me, that's for somebody else. Entrepreneurship's just for somebody else. I do this. I go, but then, and I tell them, but that's you're still you're the business. Like I always tell actors, you're the business. Writers, you're the business. Like it's not. So physicians, you can be the business. Like so, how do you talk to
Yes.
people? Because this is part of what you do in coaching, executive coaching, and talking with doctors.
Yes.
What are some things you tell people when they say things to you like, "Well, that's not for somebody else," or entrepreneurship? And oh my god, what do you say at first?
I think for me, specifically when I'm coaching physicians, is explaining to them the power of that MD or that DO. So let me explain to you what the power of that degree does. Okay. The MA is practicing under your medical license. The nurse is practicing under your medical license. The PA, everyone is under the X-ray tech is following your. All of these come from that medical license. So that person that has a medical license is driving so many other aspects. How can you get a lab? Well, you need an MD for that. How do you get an X-ray machine? You need an MD for that. How do you do? So I really start with framing when this is your profession, the law and the structures that are around you really are set for your power. However, when you only look at your profession in an employee standpoint, you don't spend any attention on any of that. You really leave that to someone else to do. And so it's really not on your radar as that entity, that business is using your medical license to set up the staffing model. Like that's what they're doing. Okay. And the supervisory agreements that are there require a physician. and your license is the one that they're using. And so I really start by kind of opening their eyes to the power, and then I think once I get buy-in on, okay, I have power, I don't necessarily need uh, job, I can create other revenue streams outside of this physician. So in that empowering, the physicians aren't as easy to persuade with some of these contracts.
Yeah.
Because when you have multiple revenue streams, you know your power, you have the ability to go out and earn a different way.
Yeah.
Then I might say no if you want me to pull a 36-hour shift. Well,
Yeah.
no, I'm not going to do that.
Yeah.
Then I might say no if you want me to see a patient every 10 minutes. I might say, well, no, but many doctors, they don't have the entrepreneur hat on. And as a result, their hands are kind of out like this to the employer. They don't really understand their power. They don't understand that they can push back with some of these negotiations. And so they're taking a lot of these contracts as is. And so I kind of start with, hey, here's how you can empower yourself. Hey, let's push back on that employment contract a little bit. Here's how you protect your lifestyle. Here's how you protect your time. So that's really where it kind of starts. But most docs that come to me, they're already looking for more. They're already burnt out. They're or nearing burnout.
Yeah.
And so they have passion for medicine. They have passion for care, but they also know that there's more out there. And through my coaching, I help them find it.
I like that. One of the principles of coaching is flipping the script, obviously. So that's one of the principles of coaching. I like that. I never thought before that way either. Like they're actually using all of your credentials, everything you are, to benefit them. So why not use it to benefit you?
Absolutely.
That's number one way. I love that. If no one learns anything else from this episode, you should. That's a good lesson in so many things. So that a lot of companies need you so they can run their business efficiently. So why not take that with you and open your own business? I'm telling you, folks, it's hard work. No one's saying this. You just wake up and it's work, but for me, 13 years in this, it's worth it. I would not want to go back to any other way, right?
I agree 1,000%. And physicians, because we have outsourced so much of the business, we've also outsourced the lobbying for regulations and political influence as well. And so that's how. This is unbelievable what I'm going to say. This is how a hospital can be a separate entity and not a medical corporation, meaning that they are not practicing medicine. So when you have business people that are in healthcare, they're going to get legislation that is written and laws that are right in place that says I can create a hospital without a medical license and I can outsource the practicing of medicine to a medical group that brings the doctors in. And I say, oh, wait a second. Okay. So if the hospital isn't practicing medicine, what are they doing if they don't have doctors?
Yeah, well, I'm telling what are they doing?
What are you? If you're not practicing medicine, okay, fine. You're
right.
not a medical group. All right, you're a nonprofit. You're this.
Okay.
You're okay. You're not practicing medicine. Well, what's a hospital without a doctor, right? And so, physicians have not wrapped their head around that question enough, and so that's why we've had a lot of business influence. Where you can have a hospital that is not quote unquote practicing medicine and they outsource the practice of medicine to the physicians. And that's just one piece. And then also for Medicare reimbursements, the registrations or the regulations as far as who can actually receive funds from Medicare.
Yeah.
If the hospital is owned by a physician, there has to be special disclosures in place. So it is illegal in some states for a hospital to be owned by a doctor because the law has it that the doctors are going to act in their own self-interest, order things that aren't needed, do more procedures than are needed, and they're going to do things that the patient doesn't need just to make more money. Now, the doctors of all people should have a high consciousness. Our consciousness should be really high, but the laws are structured and the reimbursements are really structured to basically have the physician in a position where the pay, we have to protect you from the doctor, because if the doctor owns the drug company, then he's only going to write his drugs,
Oh well, yeah,
because
of course. Well, yeah,
no, he doesn't think about what you need.
no,
The doctor is doing this because he's making money. So he's going to write drugs that he owns, even though you don't need it, but
yeah,
he's just going to write it because he owns. And so, and obviously, we've had some bad apples. Obviously, all these things have come as a result of folks behaving, inappropriately. But these are some of the things in the medicine and the structure, reimbursement, that make me scratch my head.
Are there any downfalls to for us if there are physicians becoming entrepreneurs? Are there any? Is it? Are there? I mean, I'm pretty much saying. I mean, I guess it's like any business. I guess you'll have bad businesses, good businesses. But I mean, I don't know. Is there any downfalls?
Yeah, that's a really good question, and I have the utmost respect and the utmost belief and kind of confidence in our profession. And so, as a result of that, I believe physician ownership, I believe the far majority of physicians are altruistic. They want to do right by the patient. They aren't driven by simple dollars. They're driven because they want to be good doctors and help people.
Yeah.
So, I don't see many downsides to a physician owning. For a patient, I don't see many downsides. Now, I do see downsides to pharmaceutical companies, other entities that are in our sphere. Um, Insurance companies, I definitely see a downside to the revenue that they can generate.
Yeah.
So I do see some downsides to the current players, but I think the people that are in the current system, they like the people that are making the money in the current system, like the way that it is. The fee for service model, you do more, you earn more. So you drive the physician to see more. But no, I personally, I don't believe there's any downsides to me owning and operating and practicing my profession. I don't, this is what I worked, trained, and put so many hours in to do.
Yeah.
So I feel like it's really a privilege um, to practice medicine. And I think, and with physician ownership, it can kind of allow more influence on the delivery side. And I actually believe it's going to lead to greater patient care.
Yeah. No, that's what we need. Now you're in San Diego, right?
North San Diego County. Yep. So I'm in a little town called San Marcos, but right North San Diego County.
Right. My father, my father works, well, for years worked for the association, some kind of health association stuff, and he lived in La Mesa for years and did stuff
Oh,
down
La Mesa, yes.
there. Yeah,
It's a
down
little
there.
further south than me. I'm a little further
Yeah.
north, but yeah,
But the
know
San Diego
exactly what
area
it
is
is.
a big area too. It's like
Yes, it is.
Los Angeles. There's San Diego. What is business like down there for you? Then I'm down there in the San Diego area.
So we're still in our startup kind of launching phase, but we have continued to grow. I think the difference has been clear when people come into Exhort Health, and we're continuing to up our Google reviews. If you look at our Google reviews, we're the highest ranked urgent care in the city, and so I think the community is responding to the difference that we are providing, the different way, different approach that we're going about it. So my intention is to continue to get the word out about what we do, how we do things, and continue to grow our system and our assets. My biggest vision is for Exhort Health to become a hospital system, and have the essentially become the insurance company. But instead of having the insurance dollars go to an insurance company and they shave off their profit and then use the rest to pay for care, the dollars would go straight to the system. So all of the insurance dollars would go to supporting care, supporting the hospitals, the systems, the facilities, the employees. And so I really think the marriage between, or the combining of the payer and the provider, when they become one, that's when we're going to see a significant change in how medicine is practiced, because now my incentive as one entity, because I'm the payer and the provider,
Right.
when now my incentive is to drive costs down instead of drive costs up. Right now, the payer and the provider are separate. So the only way the provider can earn more is to charge the payer more.
Oh,
And so what my plan and vision for Exhort Health is to combine the two.
right. Right. Um, do you miss the days of being a flight surgeon? Do you miss all the
I
combat? Do you miss the adrenaline rushes? Do you miss any of that stuff?
I do. I do. You know, one of the things I miss is flying. I miss flying.
Yeah.
When I first got out, I was like, oh, I'm gonna go and get my private pilot's license, and I'm gonna keep flying these little Cessnas and 300 horsepower. But after you've flown a jet and pulled 6, 7 Gs, it's not the same when you get into one of these. I mean, it's all right, but it's not the same. The afterburner is not. There's no afterburner. So, but no, I miss it. I miss it a ton. It was a unique time for me. Great way to practice medicine.
Yeah.
The flight surgeon is really integrated into the operational unit. My boss was a pilot. And so it was a great way to practice medicine because you really had to build rapport with the pilots.
Yeah.
If you did not have a rapport, if your patients did not trust you, they wouldn't tell you anything.
Yeah.
Because the pilot, I was the only guy that could say he couldn't fly, right?
Yeah.
So, and the flight surgeon is the only guy that could say the pilot couldn't fly. And so you really had to build rapport there. And so it was a great way to practice medicine, great way to hang out, get to know people. You really had to know your patients. It was a great way to practice medicine. I miss it.
That was crazy.
I love being at home now. I love being at home and not being deployed. So I will say that. Let's go ahead. Let's not leave the conversation
exactly. Yes,
without talking about that.
yes,
I do like being at home and not being deployed, but in behind barbed wires and concrete walls. But no, I do miss it. I miss my guys.
So you've been featured in several magazines and things, and you've been on shows like this and stuff. And so I want to ask you, I didn't ask you this last time, I want to ask you this time. How does it feel when you actually get attention for what you do? Because most physicians, they don't have that. They're just working. Maybe in a community, you might get an award here and there, but for the most part, you're nose to the grindstone, just working it out, work, work, work. But when you get TV and YouTube and Forbes magazine several times, and this, because I know whenever I get recognized for something, I'm always like, not me. But then, of course, you want to be like, because it's also marketing. It's good for your marketing.
Yes.
How do you feel about all that when you get attention?
To my core, I enjoy the intention or the attention because of my intention when I'm there. So it's what am I saying? What am I talking about? So what platform am I promoting with this intention? Who am I trying to encourage? Who am I trying to impact? What change am I bringing about? Like, what is the show or the interview or the podcast what are you trying to do here? Is it just, okay, Dr. Lee's awesome? Or is it like, no, who are you trying to impact? What are you trying to change? How are you using this attention for good? Who is going to be impacted because of this? So for me, I'm an encourager. My natural, I want to encourage people. So you will rarely find me in any interview, any show, anything without sharing a message of encouragement and empowerment. And so I try to make sure that anytime I get any sort of media attention or shows, that I make sure that I take some time to encourage other people, because we all need encouragement. And I feel like that is one of the reasons I'm on this earth, is to encourage people. And every time I get an opportunity to do that, I'm going to do it.
And you do.
Thank you.
So we've also the last few years have gone through some cultural changes. Some were due to COVID, and some were due to we'll say civil unrest for certain reasons, as I put pie. So how has that continued to shape you as, because I mean, you're a physician first, or you're a black man for, I don't know which way, how you classify yourself. I go through the same things all the time too. How's that informed you the last few years in terms of your blackness in relation to your profession?
Yeah, I think for for me, it's being at the table. So it's being in the conversation. It's being on the map. And um, I see where I am, or my success, or my advancement. I really see it as uh, I really seek it to be a beacon of hope and a beacon of light, um, to my people, to young folks that have come up like me, to other young men that share my skin color and my demographic and my history. I want them to see that many of these places you might not see many of us, but that does not mean that that is not intended for us. And so I want to be in the circles of business owners or the entrepreneurs, or the Forbes, and I want to be comfortable in my skin there. I want to be completely myself. I want to validate every other person that looks like me and saying, "Hey, he's from where I'm from. Hey, he talks like where I'm from. Hey, he kind of looks like me. Yeah, he's like me. Yes." Okay, so we want you here. We need you here as well. And there's a lot of folks behind you that need you to see that. And so for me, I say fortunately and unfortunately, but I'm a black man in every room that I go into, fortunately or unfortunately.
Right, exactly.
That precedes me,
Yeah.
and I love it because it gives me the opportunity to be one of the few, and it gives me opportunity to do two main things. One is break down a lot of barriers. There's a lot of preconceived notions about black men that I'm able to break down because I show up in that room and they see another version, another example, another type. I get to break down barriers. And the second thing is I get to encourage. I get to encourage and be an example for young people that come behind me that may not necessarily have seen it in your family, may not necessarily have had somebody tell you can do it. But let me tell you, young brother, once you see somebody that looks like you doing it, it's really hard for you to take that image out of that young kid's mind. It's really hard. Once they've seen it, it's going to be real hard for you to tell me I can't do it once I see it. But if I haven't seen it,
Yeah.
right, it's a little more difficult. So yeah, and I'll say the last thing with that is, really through the pandemic and through that time, I really began to think more about legacy and more about what I'm going to be able to pass to my heirs, to my children, to my family. And one of the things that I had to realize, and it hit me like a ton of bricks, was that I could not pass my practice of medicine on to my children.
Okay.
Because I spent so much time getting this medical degree and becoming a doctor and want to be able to practice. And that's something I could not pass down to my descendants. On the other hand, if I have an organization, if I have equity, if I have businesses, I can pass that down with one simple requirement: your last name.
Yeah.
And so for me and for my community and the leadership and the example that I'm trying to set is I'm pushing legacy, ownership, equity, because that is what's going to pass from generation to generation. Many of us, this is our first time being successful. This is our first time getting our hands on a little something.
Yes.
And our first time getting it. And okay, yeah, you want to go and stunt and do this? Okay, fine. You didn't come up with anything. I understand it. But at some point, we have to say, and it's my belief, and I'm a Christian. I read the Bible, and it's my belief that there's a verse in the Bible that says a good man leaves an inheritance to his children's children. And so my goal and my mark is to be a good man. And how many generations of men came before me that didn't leave me? Listen, James, I didn't leave me a penny.
Right.
How many men came through my family lineage did not think about me one time and leave me one penny. How many men came before me? And during the pandemic, there was all this unrest and all this. I'm looking at the influences and employment and people in power and who's making choices for people. And I said to myself, you know what? That stops with me and my family. That stops. So the descendants, my children, my children's children, they're going to have something left for them.
Yeah.
So I remember many times people say, "Oh, you got trust fund babies," and yeah, my kids got trust funds. Okay, yes, they do.
Right.
And there's no shame in that.
No.
There's no embarrassment in that. There's no, oh, you got a silver spoon in your mouth. No, that just means there was somebody before you that had intention when
Yes.
thinking about you and leaving you something. And
Yeah.
so yeah, I mean, for me, that was really kind of a transformation. And man, I tell you what, that was it was a crazy, crazy time for me during that pandemic, and I just learned so much and grew so much, and because of it. So it's a challenging time, but also it enlightened me in many ways, and sparked a fire in me to make some change in my life.
Yeah, everything you said, I agree with. So ditto everything you said. I mean, I'm the same way. I'm just like, if you see my face in a space that you want to be in, then I've done my job. I mean, that's the thing.
Amen.
And I have grandchildren, so I realized someone on another show told me once, James, you realize that when you're gone, they'll have all this,
Mm,
which I never.
mm,
I mean, you know, I'm working. I never thought before until they said that. I was like, they have hours of tape of you. That's not gonna go anywhere. Hours of articles to read about you and pictures, and that made me actually start thinking about what exactly I'm doing.
mm,
So doing shows like this is what I do more of now.
mm.
Shows about unity and community and honesty and positivity. I started creating more content the last 2 or 3 years when that was brought to my attention. I was like, yeah, well, I'm leaving this behind. I mean, yeah, I can be silly sometimes. They know that it's like that too. But I'm like, but what am I doing? And
Yeah.
not just them, but also all the young Black folks that are coming after us that go, wow,
Mm,
it's an interview between a physician, flight surgeon, entrepreneur, and this guy's a media empire. And they're both Black. I mean,
yes.
it's like, and they're not exactly. I mean, we look good for our ages, but I'm in my 50s. I tell you, I'm in my
Yeah.
50s, and I'm like, but I may have started a little late, as they say, but I started right on time. I'm Christian also. I started right on
Come
time.
on.
I started when I was supposed
Come
to
on.
start.
That's
Uh,
right.
but
No.
someone can watch this. Your kids can watch this. Your grandkids, my grandkids, great grandkids can watch. And go, wow, there are two Black men in here who did something.
Yeah.
I could show them that it wasn't all bad, that it wasn't all sad, and that
Yes.
the possibilities are there.
Yes. And that joy, because there's so much for me, and one of the things that I try to do with my children, and I remember,
I told you, it always
I
happens.
remember, I
You
was
be on the show, starts to the phone ain't ring before we were
I
talking.
was like,
We,
I was doing so great. I'm
we're
gonna
getting
do
towards the end, but of course,
do not disturb here.
we had a huge
Um,
laugh about that, folks, off camera. Go ahead.
uh, this is one of the things in that joy, right? And that happiness, because I remember so much when I was growing up that there was a lot of heaviness. There was a lot of serious. There was a lot of, not a lot of room for mistakes. There was a lot of discipline, and nothing's wrong with that. But I just remember in many instances where, my parents would talk to me and say, you know, this is life and death. Sometimes, you deal with a police officer the wrong way, you could die. And so I just remember, and then you watching things on TV, and when I was growing up in the '80s, it was like, if you were gonna, if we're going to um, make it to 19 or 21 or all these things, and this was something that was really in the forefront of my mind. um,
And here,
and so for me and my kids and my children, it's more of the light side and the joy, and this is what the happiness, that's a piece of being a kid. That's a piece that needs to be protected. So
yeah. Well, Dr. Lee, my friend, thank you so much for being on the show again. You have to come back again another time, of course. You're welcome back anytime. So thank you.
Absolutely. I appreciate you, brother.
So so folks, you can go to his website, which I had it written down. So can you tell me your website is?
Just clarenceleejr.com.
Yeah.
Yeah, so you can find clarenceleejr.com. You can look at all the books and different media hits and reach out to me. And then on all social media platforms, just at Dr. Clarence Lee Jr., all the handles.
So if you're in San Marcos, you want some good care, go to him. No doubt. Go to him. Check him out. Tell him what's going on. Read those Google.
And exhorthealth.com for my company.
And I'll put that I'll put all this in the description. But yeah, go check him out. See what him and the staff are doing over there. I'm James Lott Jr. You can follow me. We're all James Lott Jr.'s are at James Lott Jr. everywhere. And we will see you next time.